Hi, Jamie Davis here from the Nursing Show here at ANIA 2016 in San Francisco. I'm excited to be chatting with Emily here. She's one of the speakers at this event, and we've had some great speakers that I've already interviewed. I'm looking forward to hearing what she has to say. But Emily, before we get into talking about what you're going to be speaking on later, why don't we first ask you why you wanted to become a nurse?
Well, actually, it's a pretty funny story. Originally, I wanted to be a doctor because my mother is a nurse and I wanted to boss her around. Which, of course, as most people know, you can't boss around your mother. But I actually grew up, I'm a second-generation nurse. I grew up around Mass General. I actually was picking up patient phones and handing them little things when I was about 4 or 5 years old because there was no babysitter, so Emily went to work with her mother. And so as I got older, I realized that I loved nursing more than going into pre-med, so I eventually went in, and I wanted to kind of change people's lives, help, as, you know, the common things people say when they want to become a nurse. But as I kind of worked in nursing, I realized I wanted to do a lot more, which is why I ended up in nursing informatics, because you can do a lot of stuff on a big scale and reach a lot of patients all at once, which I think is awesome.
And you have a DNP now, is that correct?
I do have a DNP, and actually I realized that I like to teach, and so I'm going back to get my PhD in the fall.
Excellent. Well, that's awesome. So what are you talking about? What's your topic for discussion when you go to do your speaking in a little bit?
Well, my background is a med-surg nurse, so I actually I worked on an acute medical floor at Mass General, and one of the things that we did was we worked with a high geriatric population, and they gave us this geriatric Terry Frommer's spices tool, and and there's this whole list of interventions with it. And basically what I'm going to talk about is that tool, how it's utilized currently and how it can be utilized in the EHR, and using clinical decision support to do that.
And it's so important to integrate the tools that we know how to use, our assessment tools that maybe we've been trained to use for years, is finding ways to cleverly integrate them into the electronic tools that we need to learn to use. And maybe that'll improve uptake. Is that what I think you're saying?
Well, yes, but and also the geriatric population, a lot of people forget is that you've got to be more proactive than reactive. If you become reactive, patients become delirious, they end up falling, they have worse outcomes, and of course you want patients to go home better. You don't want them to go home to somewhere that is not better, obviously. And so that's kind of the point. But the other point about clinical decision support in itself is everybody thinks of it as an alert. It's not. There's care plans. There's other ways that can just aid nursing to be able to go and say, they don't sleep as well at night. That's a risk factor for them having delirium at night. Perhaps I need to do X, Y, Z, or perhaps I need to give them just Play-Doh because they keep picking at their IVs and such, and that will help them, do better. I have a great story where I actually had a patient. He was very combative, and one day I decided. He just kept asking for a pencil, and people thought he was going to stab all the family. And actually what really happened was I gave him the pencil, and I figured if I get stabbed, it's my fault. He wanted a card, and he was actually having a hallucination where he was playing the dogs at the Raynham Dog Track in Massachusetts. And so he just sat there like this, looking up and down, and I Love Lucy is on the TV, but he thinks it's the dogs. We were able to work with that. And instead of being reactive, I was trying to be proactive and find a solution. Before that, they were medicating him, he was being restrained. It's just a matter of changing your way of thinking, and putting that into the EHR is an important thing, because it reminds nurses to be proactive in their care.
And to really think about how there are other interventions available for them, especially in the care of the elderly patient with delirium, that are not medicating them, that are not restraining them in some way, that can be a better solution for everybody involved.
Absolutely. There's those picky vests. There's, you got to prevent UTIs. So you have to get them up and toilet them every 2 hours, or you have to, if you can't get there, try to get somebody else, one of the nursing assistants, whoever you have on hand, things like that. So it's really, really important.
So final question, what do you think of the importance of coming to a conference like ANIA? Some people are going to be watching this video that weren't able to attend, and maybe they're thinking in the back of their mind, hey, maybe I should try to get to New Orleans next year and go to ANIA 2017. What would be your response of why it's important to come to this conference?
It's all about learning. It's all about doing the work, being encouraged to do the work, and then being able to disseminate it out, and so that others can replicate and do the work. Because it's really important to pass that knowledge on. Because if you hold it in, yes, knowledge is power, but what is it going to gain you if you don't give it to other people and share it? And I basically would say is this is my 4th ANIA in a row. I make a point to come here, and I think it's so worth the trip and the time to do it.
Yeah, and I've heard people talk about the fact that they're sharing information, the networking that goes on in between the sessions, the lifelong friends that are made here, all make this far more valuable than just some educational sessions.
Absolutely. For instance, I was just talking with Cheryl. She was originally my mentor, and now I once in a while, if I really need just some advice or even just a hey, what do you think about this? She is wonderful about doing that. Without ANIA, I would have never been connected with her.
Excellent. Well, thanks so much for chatting with me. I appreciate it.
Thank you very much. I really appreciate it as well.
And I want to thank all of you for checking out this segment here at ANIA 2016 in San Francisco. Remember, all of the videos that I shot here, all the interviews I've done, are available for you over at ania.org, ania.org, and also available over at nursingshow.com.